Getting IVF can be an emotional process. It's also an expensive one. But what if there was a way to guarantee it worked or your money back? London-based company started an all-you-can-treat IVF policy. Comes with a promise of a refund if the couple doesn't conceive after 2 years. They say it lets patients know exactly where they stand, gives them a sense of assurance. Now, it doesn't cover everything. It doesn't cover the medications, but it does cover the cost of the actual treatment. There are a lot of stipulations. We were talking, a woman must be under the age of 38. They charge a higher price for it. It's not like they're just charging the standard one IVF treatment cost.
So the average cost in London for one IVF is £3,000 to £5,000, and the cost for this all-you-can-treat package is £9,000. So they're already kind of averaging in. You might end up doing it twice in order to take advantage of this type of guarantee. But I mean, it's an interesting thing because only 5% in the United States of people who are infertile and can't conceive actually go to IVF. And a large part of that is the expense and the very low success rates. I mean, even currently, based on all the improvements in technology and the improvements in older patients, it's only about 22% successful in terms of achieving a live birth. I actually think this is really a step in the right direction.
It is.
I agree.
Even though it's a higher cost, I think it can be a bottomless pit. And so if you keep going through these rounds and you keep spending all your own resources, because many insurance companies don't cover IVF benefits, I think you can end up spending a lot of money and
there can be wayward goals. If you go into a clinic and no matter what, the clinic just keeps getting paid, well, there is a disincentive for them to say to you, look, this particular treatment program may not be best for you. If you have this type of program in place where you get a refund, if it does not work, the clinic really has it in their best interest to be very open, transparent, and honest with the individuals who show up for IVF, because what would the benefit of a false promise be? There'd be none for the clinic, whereas right now in certain clinics, the incentive would be, let's do it again. Let's do it again. And there comes a point where if you're bankrupt, what do you do? At least, and would you recommend this, or would you be happy if this type of program came to the U.S.? Because I would, because I think it would put a downward price pressure on treatments that are very, very expensive.
I think it's fair to keep some for expenses, but if you're unsuccessful, that you would be entitled to a partial refund, for example.
It is in the U.S. also about $12,000 out of pocket per round for IVF. So I think aligning the incentives of the clinic to get it done quickly with your desire and incentive to actually have a successful live birth, I think that's really a step in the right direction.
I mean, there's no guarantees in medicine, no matter what we do. So that being said, with the numbers that you alluded to, I think some sort of refund would be better.
Well, these
and an incentive for the clinic.
You know, and these are the kinds of incentives that we maybe need to consider in other areas of medicine as well, because right now a lot of what you see in medicine is treatment over treatment, and as long as everyone's getting paid for that over treatment, there's really no incentive to really step back and say, okay, well, wait a minute, what is the best course of action for all parties here?
And I think from the clinic or the provider's side, it'll set up that very clear communication from the outset that if you're a bad candidate for this and it's unlikely to be successful for you, they're not going to give you this guarantee. That's a tremendous amount of information for you right there, that the odds of success are incredibly low. And maybe
doesn't mean you shouldn't.
Yeah, but it may not be the right course.
But at least you have a transparent conversation.